A couple of months ago, Apple and Google, two of the biggest companies in the world, announced their plans to assist with the tracking of the coronavirus. At the time, we made a video about it and compared their plan to the one that the NHS in the UK was following. Since then, a lot's changed though. Google and Apple's plan has been developed and the rollout has already begun, while in the UK, the government has dropped their original plan in favour of the one developed by the tech giants. So, in this video, we're going to explain exactly what Apple and Google have planned, why they're getting involved, and why some people are worried about big tech tracking them. Before we get into that though, if you haven't already, please subscribe to the channel. We're covering a whole variety of news topics, from COVID stories to non-COVID issues. And if you subscribe, you'll be helping us out a whole bunch, and you'll also be more likely to see our stuff going forward. Also, if you're from the EU or US, or if you're just interested in those countries, then be sure to check out the special channels we have dedicated to them, which publish content exclusively to TLDR EU and TLDR US. There's a link to both channels in the description, so you can subscribe now to make sure you're getting all of the content from us. So, the very basics before we get started, and sorry if you've heard this from us before. Let's discuss the origins of contact tracing. The basic idea of contact tracing is that when someone finds out they're infected, they reach out to everyone they've been in contact with, especially those for a prolonged period, letting them know about the infection and telling them to isolate and test themselves. So if you find out that you've had the virus, you'll ring round a whole bunch of people that you've been close to recently and could have infected. Standard contact tracing is far from perfect though. Firstly, you can't expect everyone to remember exactly who they've been in contact with recently. There would be some friends and family who would be easy to list, but in normal life, you come into contact with many people you don't even know, in restaurants, in the cinema, or on the tube. The number of people that you come into contact with and could have infected is therefore huge, and many of the people you don't even know, making traditional contact tracing very difficult. The good news, at least I think it's good news, is that in the modern day, we don't need to remember all those people, as our phones can do it for us. Your phone makes the list for you. The exact method varies depending on who's implementing the system, but the core idea is that your phone exchanges data with those around you, so that you have a comprehensive list of every device and therefore every person you've been near in recent days. Now, the system isn't foolproof. For one, it assumes that everyone has their phone on them at all times, and that every phone has the software activated. But the hope is that even if it's not perfect, it will work better than manual contact tracing. When it comes to implementing systems like this, it seems like a lot of people think they'd be good at it, from governments to tech companies to some random dude on Twitter who's an armchair computer scientist. But as two of the biggest companies in the world, Apple and Google are a pretty natural fit for a task like this. After all, the two companies control the software in 98.92% of the world's devices, meaning that these two are better placed than almost anyone else to develop a protocol like this. So, what did the Silicon Valley giants come up with? Well, their answer was Exposure Notification API, and based on Apple and Google's own slides, here's how it works. If two people, here Alice and Bob, come into contact with each other, their devices connect via Bluetooth and share an identifying key. Let's say for argument's sake that Bob's phone sends Alice key number 004852, and Alice's phone sends Bob 180417. These keys are completely unique, and no other device will use the keys. In fact, even Alice and Bob's keys change every 15 minutes in order to protect individuals' privacy. In the end, the two go separate ways. Alice and Bob still don't know each other, and despite a moderately interesting discussion of the weather while waiting in line at Tesco, Alice and Bob forget that they even spoke within a day or two. However, a few days later, bad news strikes. Bob finds out that he has the virus. When he's diagnosed, he goes into the app and updates his diagnosis, at which point the app automatically pushes his last 14 days worth of keys to a centralized server, which contains the keys of all the infected people. That means that every key that Bob has had in the last 14 days gets added to the list on the server. And considering that the key changes every 15 minutes, that means 1,344 keys get added to the list. Importantly, That includes key number 004852. Alice's device is regularly checking the server and comparing the keys it's collected from nearby people to those on the infected keys database. It's regularly searching to see if any of the keys match, because if they do, if the phone holds another user's key that matches one on the infected people list, then it means that a person that Alice has been in contact with is infected, and therefore she might be too. So when Alice's phone checks the server for the first time after Bob notifies the system, it spots a match. It finds key 004852, the key that Bob's device sent her when they had that chat outside Tesco. At which point, Alice's app notifies her that someone she's been in contact with is infected, as well as giving her advice from her local health authority and information about how she can get tested. This whole system means that Alice is able to get herself tested and the assistance that she might need. It also means that Alice was notified when she wouldn't have been otherwise. If Bob had been asked to manually list all of his contacts, he wouldn't have put Alice on the list. Despite their scintillating conversation about whether it would rain later, Bob had forgotten that they ever even met. And even if he did remember, Bob didn't know Alice's name, let alone her contact details, meaning that in a standard manual tracing, she would have slipped through the net. Using this tracing system, Alice was notified, and not only that, the whole system endeavours to do it all anonymously. Unlike some systems, like the one that the NHS originally planned, there's no centralised server holding everyone's information. In the NHS's original version, there would have been servers which held records of who'd been in contact with who. And even though this data would have been anonymised, it still poses a privacy risk if it was hacked. The Apple and Google model doesn't have this issue, as the only place that the meetings are tracked is through the devices. The only way that Alice knows she met Bob is because she has his key. And because the key was only stored on her device, that means there's no centralized system, which if hacked could reveal their connection. The key was also changed every 15 minutes to keep Bob anonymous, and even still, it doesn't link back to his identity anyway. That means that Alice's device doesn't know which person gave her key 004852, and it doesn't need to. Using the model, it's not important who gave her the key. All it needs to know is that Alice was recently near someone who gave her the key, and that key is now listed as an infected key, and possibly Alice is infected too. Now, this is a serious simplification, and the keys obviously aren't just a simple 6-digit sequence, because if they were, then we'd run out of keys in seconds. Regardless, I hope this explains how the system works, how people are notified if they could be infected, and how the systems have been deliberately engineered to keep things anonymous. However, understandably and sensibly, a lot of people aren't just taking the company's word for it. And as much as tech firms might like to pretend to be your friend all the time, it's reasonable to question their motives a bit, and ask if they're really keeping things as secure as they claim. Therefore, many are concerned about the privacy implications of this software. But, as I explained a moment ago, efforts have been made to ensure anonymity, from the regularly changing key your phone broadcasts to the anonymous key uploads made to the centralized servers. The system's not perfect, and Ashkan Soltani, former chief technologist at the Federal Trade Commission, has come up with a good example of how someone could use surveillance cameras to try and identify those who are infected. But this is a far from easy process. Others were also originally concerned about the usage of GPS and location data. However, that's not an issue with this plan. As I've explained, the Google and Apple approach uses Bluetooth, and as such, it doesn't require any form of location or GPS tracking. Another concern surrounds false positives, and it is a real concern that if the system doesn't work as planned, if it notifies too many people you weren't even close to in the first place, it risks undermining the system. The solution suggested by Apple and Google is to implement a process where healthcare providers give patients a unique key when they've been diagnosed to mark them as infected. This way, trolls can't just light up the system with false positives, and only those who are genuinely infected can notify the system as such. The greater issue with this is that Apple and Google's solution is only an API, or application programming interface. Think of it as a basic blueprint. Apple and Google aren't making an app or a system. Instead, They're providing a basic interface which governments can use to develop their own apps and systems. This might seem good if you trust your government more than these tech giants, but it could also mean that governments are misguidedly or maliciously going against Google and Apple's privacy advice. It could lead to governments collecting more data than is necessary and asking for location data to pinpoint cases better, ignoring the privacy concerns that arise by doing so. Which means that as interesting as Apple and Google's advice is, it's only advice. To properly judge these systems, you'll have to take a look at every system that individual governments are rolling out in the weeks and months ahead. Regardless, Apple and Google are already changing their operating systems, iOS and Android, in order to prepare for these new apps. In fact, one such change last week caused quite a stir when some mistook changes within their phone's OS for a tracking app. Both companies recently rolled out new settings on their devices, all about COVID exposure. The setting is turned off by default, but some still worry that it might mean that their devices were being used to track them. But this is absolutely wrong. All the update does is allow government-designed apps to run in the background while still using Bluetooth. This isn't something that apps are normally allowed to do for privacy reasons, but as tracking apps need to be always on and using Bluetooth, they need to be given these special permissions. So this new setting merely grants verified government tracking apps with the access they need. The keyword here being verified. That's because only official government apps, which have been signed off as secure by Apple and Google, get this high-level access. And anyway, it's turned off by default. So even if you were worried about being tracked, you're not. You'd first need to download an app which can actually do the tracking, and then turn on the setting to allow it to function. Anyway, enough myth-busting for one video. What do you think of this all? Do you think that Apple and Google have designed a good, modern version of contact tracing which will make the practice more effective? Or do you not trust these big tech companies and/or your government to develop an app that you're happy to install? As always, be sure to let us know your thoughts in the comments below, and you can get involved in the conversation over on Discord. As I said at the beginning, be sure to subscribe to the channel and hit the bell icon to be notified every time we release a new video. Special thanks to our Patreon backers who make videos like this one possible.